Hi, my name is Skip Flanagan, and I'm the NTID Athlete Development Program Coordinator. The goal for this video is to translate the new athlete's clearance process from English into American Sign Language. This is for all the new athletes who are competing at the varsity level at RIT. All incoming new athletes, freshmen and transfers, are required by the NCAA to have a pre-participation sports physical evaluation within 6 months of beginning sports participation. This pre-participation evaluation will be performed by our team physicians and/or other Rochester General Hospital staff on your team's designated clearance date. If you have had an injury or procedure that required medical care within the past 12 months, a written medical release from the attending physician for your injury is required. If you have had any previous cardiac testing, EKG, ECG, stress testing, please bring a copy of the test and test results. Our team physician will want to review these results prior to your clearance to participate. New students to RIT will receive an email from the RIT Student Health Center, SHC, regarding immunization verification. Please follow the steps to complete this process. RIT Sports Medicine will verify immunization status within the SHC as part of our clearance process. Please make sure your information is received by the SHC in a timely manner to avoid delays in clearance for athletics, especially as we near the beginning of classes at RIT. The NCAA now mandates all athletes have sickle cell trait testing performed, show proof of sickle cell trait testing, or sign a waiver releasing the institution from any liability related to declining testing. The pre-participation sports physical evaluation form now has a section relating to sickle cell trait that must be completed by a physician. If you have not been tested or have records of this testing from birth, our team physician will discuss testing and waiver options. Absent of providing such information, the student athlete will be allowed to participate in intercollegiate athletic events only after signing the sickle cell trait testing release and waiver of liability. If you have been tested, bring proof of testing and the results. If you have not been tested, our team physician will discuss testing options. You have the option of declining testing and completing the waiver. The NCAA bans classes of drugs because they can harm student athletes and can create an unfair advantage in competition. Some medications contain NCAA-banned substances but are needed by student athletes to support their academics and general health. Accordingly, the NCAA has a procedure to review and approve use of certain medications that contain NCAA-banned substances through a medical exceptions procedure. For example, the diagnosis of adult ADHD remains clinically based, utilizing clinical interviews, symptom rating scales, and subjective reporting from patients and others. If necessary, the medical exemption form can be found in the e-file section in ATS or from the sports medicine section on the RIT Athletics website. This is not necessary for participation clearance, but may affect eligibility if you are drug tested through the NCAA. If you utilize an inhaler for any condition, including asthma, please provide medical documentation that supports diagnosis and prescription. This documentation will be kept on file to support exemption in the event that you test positive for a banned substance through NCAA drug testing. We utilize the Athletic Trainer System, ATS, which is an electronic medical records system. This software allows us to collect clearance paperwork in an electronic format, as well as maintain medical record-keeping information for the sports medicine department. The following information will help you to navigate the system and provide us with information necessary to your clearance to participate in RIT athletics. Once all the information is accumulated and reviewed, we can complete the rest of the clearance process that is usually performed at a pre-scheduled time with your team or individually with sports medicine staff. Please try to complete the following process at least 1 week prior to your scheduled clearance meeting to avoid delays. Open your internet browser, clear the address bar, and type or paste rit2.atsusers.com. No www or http://. The ATS web portal login screen will appear, and the database, ATS RIT, should already be filled in. Enter new for athletic ID and new for password. This will bring you to the Athlete Information option, General tab. When logging in after initial setup, these tabs are available under the Athlete Information option. There are 5 tabs: General, Insurance, Contacts, Athlete Forms, and E-Files. General tab. Select Organization, RIT Athletics. Select your sports. Any yellow shaded fields are required and need to be completed. Phone, best means of contacting you. This may be your cell phone number. If you have a mobile phone, enter cell number and text address so we can contact you in an efficient manner. Directions are provided for entering text address next to the field if you click on the link. Additional address number 1 is your school address. Additional address number 2 should be your non-school address. Change your athlete ID to match your university ID number. No spaces or dashes, hyphens. This is a 9-digit number with 4th and 5th digits being zeros. Change your password. Do not provide driver number or passport number. If not taking meds, then type none into yellow field for medications. Save. Click plus add. Health insurance is required for intercollegiate athletics participation. We need a copy of the front and back of your insurance card. Uploading a photo of your card in this section is recommended. Otherwise, a legible hard copy can be provided at scheduled clearance appointment. Do not provide Social Security number. Necessary info. Insurance company. Payer number. This refers to level of billing, primary insurance equals 1, secondary equals 2, etc., to policy number subscriber ID number. Service phone number. Group number if there is one. Policyholder name and date of birth. Click Save. Contacts tab. Click plus Add. Provide as many emergency contacts as necessary or desired. Save Athlete Forms tab. All forms listed here are required for participation. Select Pre-Participation from the Form Name drop-down list. Click on the New button. Complete this form. Please be specific with information: which side of the body, dates, and care received. This form must be completed in one session. Save. Repeat this process for the following forms. Acceptance of responsibilities and risk. Drug and alcohol education and testing program student-athlete consent form. HIPAA. Sickle cell trait testing waiver. Student-athlete concussion statement. Now to the last, E-Files tab. This tab contains additional documents that may be necessary as described previously. There are also forms that pertain to returning athletes only. Medication exemption form. Only necessary if prescribed a medication containing NCAA banned substances to be completed by prescribing physician. If necessary, click on View option to download document for saving or printing. Health history update. For returning RIT athletes only. The RIT Sports Medicine staff will be able to review your ATS account and may contact you to address issues regarding your clearance. Please contact Ben Emke with concerns or issues. Thank you for your attention to these requests. Tips for a clearance appointment when you're on campus. Have all the necessary ATS information and paperwork completed. Come dressed appropriately or bring clothes to change into. Loose-fitting or athletic attire is necessary to accurately assess flexibility and strength. If you have corrected vision, please wear contacts or glasses for the vision exam. I hope this helps. Please contact Ben Entke if you have any questions or concerns. Thank you, and we look forward to having you join RIT Athletics.